Hello and welcome to today's Equally UK video where we've got Dolly who'll be showcasing the work that she's doing within her trust. For those that don't know me, I'm Emma Bailey and I work at Centre for Mental Health, project managing Equally UK. Dolly, I'll let you introduce yourself.
Hi, my name's Dolly Sud. I'm a mental health pharmacist from Leicestershire Partnership NHS Trust. I sit on the Equally Well clinical group. I'm a senior mental health pharmacist and I am in the final year of my PhD.
Thank you for joining us today. Would you be able to give us an overview of the service that you've been providing?
So the service that I'm leading on in Leicestershire is a service that is aiming to improve the physical health monitoring for patients who have severe mental illness. So this specifically is focused on blood tests and screening for lifestyle factors, diet, alcohol and smoking. So what we do is we gather all the basic physical health data from various systems. That includes clinical records, lab systems, and we may get some information from the service users and lead clinicians as well about patients and the GP. And we look at which physical health monitoring has and hasn't been done. For the things that haven't been done, we'll prompt the appropriate care professional to get those done either by sending a blood form or by advising on what needs to be done. And then where it's not done, we'll send more reminders. When we've got all that data together, I will do a clinical check to see if there's any interventions needed for any of those checks. So for example, if I notice that somebody's check for their blood glucose levels or their long-term diabetic monitoring is out of kilter from what we'd normally expect, then I would remind or advise the lead clinician or whoever's looking after the patient to follow up on that.
Who came up with the idea to take this approach and start the service?
So it's a really interesting thing, and sometimes these things happen almost serendipitously, but about 7 years ago, the head of pharmacy in Leicester was giving each of the pharmacists various projects and gave me a project to look at monitoring of medication. And we already had the lithium register running within Leicestershire. So we thought about this for some time and we looked at our basic data that we had collected on patients who are on antipsychotic medication, and it was very apparent that patients who are on antipsychotics, we weren't really doing very well on looking at the basic physical health checks at that time. So that's where I decided to put the focus and our energies into that. And at that time we didn't have much resource, but we decided to use the same model as our lithium register to see if we could translate some of that work to looking at these physical health checks. Luckily, about a year later, the National NHS England sequin came about. So we were able to have discussions with our then medical director and ask for some support to expand the service and really put some dedicated resource into the service and see if we could actually meet the targets of the NHS England sequin. And that's really where it came about. So it wasn't necessarily an original idea, but we based it on something that we already had running, which we knew that was successful. We spoke to the individuals who were running the lithium register and see what their experience was, and we gathered our own experience and what we know in pharmacy, along with a consultant psychiatrist within the trust. That's how we originally started the service. We were very lucky at the time to have such great support from the medical director and some of the lead clinicians within the trust. Yeah.
Are you able to describe some of the barriers that you encountered?
Yeah, so if we start with some of the barriers first, it's something that is an original service. We're not aware that anybody else has set up a similar service anywhere else in the country. So we're really kind of treading on untrodden path, really. So we had to learn a lot of this from scratch, although as I said, we've already had some success with what we've had with the lithium register in Leicester. But looking at physical health in SMI is a completely different situation. There were things that we learned as we went along. So initially we started off with a paper-based service, which proved to be quite unsuccessful, and we moved completely to an electronic service, which really streamlined things for us. Making sure that everybody in the trust was aware of the service we were running and why we were doing it and the importance of it. And that kind of really speaks to, at that time when we started the service, which was about 6 years ago, was about the culture around understanding the importance of physical health in mental health, and to achieve that parity. Not that physical health is any less important, but should be considered to be equally as important as mental health. So there was changing the culture and understanding about, well, why do you need to do these blood tests on a regular basis, and why is it important to follow up? And then there were more little things like understanding, for example, which coloured test tube you should be using to check somebody's glucose levels or their lipid levels, just little things like that, which we didn't realise initially that those things might have been sort of barriers, but for some of our healthcare practitioners it was. So we found ways to kind of deal with those barriers as we went through. In terms of the facilitators, I would say, as I've mentioned, the fact that we had dedicated resources which were pledged by our medical director, that was a really, really important thing. And that at that time, it was my role, and I had time to focus just on that. So there was 2.5 days a week just to look at this particular topic, and just to have me dedicated towards it, and the staff on my team looking at that, I think really managed to boost the awareness of other staff, but also the fact that we were able to successfully roll the project out and achieve the results that we did in the way that we did it, really helped our situation. And also then expanding that service out. So we also did education sessions for all different staff. So we'd go out, well, at that time we didn't have COVID, but we were able to go out and visit staff at different areas, different teams, feedback on results of audits and things like that. But the main thing is having that dedicated resource, I would say. And also from my point of view, the head of pharmacy and our management were very supportive of me doing that work. So I was able to go to various conferences, to ask for support wherever I needed it, to learn more about this area, because I wasn't fully conversant with everything that I needed to know. For example, linking up with our physical health colleagues in the acute trust and understanding their expertise in this area, knowing when to refer to them. So all of those things we've kind of managed to tie together. And then since the sequin has finished, because we had done such good work in this area and we've achieved so much, we know that there's a lot more that we still need to do. For example, engaging with service users, patients and their carers. The trust have very usefully continued the funding for the service post the sequin. So the sequin from NHS England really boosted this and really prioritised it for us to allow us now to provide that continued service.
Have you had any feedback from the people that are involved in the service on their views and experience of the service that they received?
So this was something that I identified that was a gap actually in the service when I ran it. So I was acutely aware that within the remit of the national sequin, there wasn't necessarily scope, or it wasn't mandated that you should necessarily get patients and service users and carers involved. But this was something that I identified that actually was a really big missing piece. And that also actually turning the whole thing on its head, and actually for patients and carers to ask and for them to understand the need for these checks and to ask service, demand from services, actually these checks are a necessary part of my treatment and my care for my diagnosis and the treatment that I'm on, really could push things the other way. So as a result of me identifying that, I then decided that actually this would be the focus of my PhD research. So my PhD research was looking at the experiences of patient service users and other care professionals, informal carers, as well as pharmacists and pharmacy professionals, about their views of physical health care. And part of it was the service that we're providing. So really looking at how we might improve that, because if we don't involve patients and carers, actually it would be a huge oversight, and not knowing things that we don't know is very important. So there may be things that I haven't identified that we could use that might help move the service and push the service forward. So we're still working on the results of that, but that's something that will come out as time goes on, as we move forward. Yeah.
What other work is happening at the Trust to support the physical health of patients with a diagnosis of severe mental illness?
So one of the visions that I had when we started this work a while ago is that this shouldn't just be piecemeal or token work, and it's just not to tick that box from NHS England, as much as that was helpful. I was very aware that we need to expand the whole conversation beyond just looking at the checks for the weight and, for example, checking for glucose levels or HbA1c and things like that, lipids. I thought it was very good if we had a physical health working group or a steering group within the trust that should be multidisciplinary, but also should have patients and informer carers sitting on that group to expand the conversation, the discussion beyond that which I've just spoken about, but also looking at dental health, physical therapy, exercise, social prescribing, but that we're looking at all of the elements and the key stakeholders in that. So this would include physiotherapists, nurses, doctors, social workers, and the whole myriad of care professionals that are involved in patients' care beyond just the scope of what's going on in an inpatient setting, but through discharge and when people are at home. And we've been very lucky that's now happened for our trust. And so we also have been very lucky to have a GP who works within our adult mental health unit, who provides services regularly during the week. So that person is a reference point for our medical staff and other staff. We also have, so patients can be referred to see the GP. We also have registered general nurses as well working on our adult mental health unit. So they work alongside our mental health nursing staff, providing both, so they're sitting together and working together, providing care. So those are the two really big things that have happened, but we've still got much work to do. We're not anywhere near where I think we should be and where we need to be to improve care. So there's lots of work that's going on, including looking at competencies and training for staff, but again, focusing on what patients and informer carers want and thinking about what their needs are and listening to what it is that we're not necessarily doing that we could be doing and should be doing much better. Yes.
Thank you so much for sharing that with us, Dolly. I think it's absolutely brilliant when we can showcase some of the work that our members are doing, rather than reinventing the wheel, learning from one another, but also, as you say, not just stopping where you finish a check or a piece of work, and instead continuing it, constantly improving. And that's one of the things that we really welcome at Equally Well. Just seeing how much better we can do by adapting a service, reviewing it, and also sharing it so that other members can learn from one another as well. So I hope that anyone watching this today has found it helpful, and thank you so much, Dolly, for joining us and sharing.
Thanks, Em. Thank you.
Thanks.